I'm Paul Shupe. I'm an orthopedic surgeon for UT Orthopedics. I'm a team physician for the University of Houston, for George Ranch High School, and a few of the other high schools around the Houston area.
And I'm Andrew Li-Yung Hing. I go by Andrew Li. I'm a primary care sports medicine physician here at UT Orthopedics and team physician at the University of Houston as well.
Andrew and I tonight are going to be just briefly running through in-season injury management. No specific sport, but just sports in general, with Andrew discussing some of the medical things that we typically see, and I'll touch briefly on some of the orthopedic or musculoskeletal conditions that we tend to see as our seasons begin. So just wanted to start out with an overview, starting with prevention. So many of the injuries that we see are preventable. We talk about proper training, proper equipment, proper nutrition, and sleep hygiene. So on the front of proper training, do you have some things that you typically like to review with your athletes and parents?
Well, first off, at the beginning of the season, I think it's really good to get to know each and every one of our athletes. So we pretty much start with a PPE or pre-participation exam. And with that, we can identify anything that they've had any problems with, or any type of injuries that they're dealing with that we can help them get through the season to prevent any further type of injuries. So one of those on a medical side would be any type of maybe prior heat injury or heat illness, and depending on where they come from as well, since that could be from anywhere around the country. So proper acclimatization and climate change can really help with their progression throughout the season to prevent any type of injury. One of those things would be starting with their workouts, with acclimatization. Really within the first 1 to 2 weeks is really important when they start with their sport.
Sure. We also like to emphasize some programs. I know for our youth that play soccer, we have prehab programs where they teach our girls how to jump, how to land, which can prevent ACL injuries and other knee injuries during the season. And a lot of those programs are going through some of our physical therapy clinics here in the Houston area. We like to emphasize proper stretching, proper warming up. Andrew talked about the acclimatization period. It's important not to go from 0 to 100 on day one, but slowly getting into that groove. Talk about proper hydration, especially here in Houston where the humidity is very high and you're sweating a lot. That can help prevent some of our heat injuries that Andrew mentioned. After these so we consider that proper training, and then we'll also talk just briefly about proper equipment. When I was in the Navy several years ago, I had an athlete that came in to see me just complaining of feet pain and knee pain. When I looked down at his shoes, I asked him how long he was wearing this particular pair of shoes or how often he changed shoes. He said the last time I got a new pair was probably 2 years ago. Getting him a new pair of shoes within 2 weeks, he came back and saw me, and his ankles, knees, and feet felt significantly better. So proper shoes, proper eyewear, mouth guards, helmets, proper pads and equipment are helpful also to prevent that type of injury. What about nutrition, sleep?
So with nutrition, sleep, I would also include hydration that Dr. Shupe mentioned earlier. And one of the things that we can try and prevent with this also acclimatization heat is going out too hard. There's certain things and conditions that, depending on whether they start at the beginning or even in season, we want to make sure that they don't overdo anything with overexertion. But that could lead to muscle injury as well. So proper rest and recovery is really important to prevent something which is called rhabdomyolysis that can cause some muscle breakdown. And a lot of our athletes really want to impress right from the get-go, but we want to slowly, gradually improve over time and make sure that they're safe. So with that, proper rest and recovery is very important. Sleep, as was mentioned earlier, and especially with nutrition.
So Andrew, why don't you tell us a little bit more about the importance of sleep and a little bit about nutrition?
So, first thing in the morning when you wake up, make sure you get a good glass of water, hydrate, get prepared for your workout and for the rest of your day. And then make sure you really have that first important meal to make sure you're fueled up. And after your workout, it's always critically important to make sure that you replenish what you just burned off. And then throughout the day, if you've got more to do, make sure to not skip any of those meals to get prepared for the next practice or whatever is inclined for the remaining part of the day. But it's really, really important to be hydrated and fueled up.
So what we thought we'd do next is just talk a little about, so we've prepped for the season, you have your proper equipment, you've prepared for things. Injuries can still happen. So what happens during the season when these things occur? So we can have medical injuries, which we've talked about a little bit, the rhabdomyolysis, we talked about concussion, we talked about heat-related injuries. There's also musculoskeletal injuries. We divide those into overuse injuries, your tendinitises, your stress reactions or stress fractures, and then you have your more acute injuries such as muscle strains, ligament sprains, fractures, contusions, dislocations, and such. And so we wanted to talk a little bit about those currently.
Dr. Shupe, can you give us some examples of some of the common strains or sprains that we would probably see during a season?
So very common, it may be sports related, so we'll kind of keep this general, but we talk about contusions. As football starting, you may have an athlete, or a baseball player, basketball player get kneed or nailed in the quad. So a quad contusion is very common. Contusions can take several days to weeks to heal. The importance is managing those from the beginning, keeping the muscle on stretch, and having that player or that athlete keep the muscle active so it doesn't tighten up. A lot of times we'll like to wrap that person with their knee in full flexion, either overnight or at least for a short period after the practice so that they're able to actually flex their knee. If that muscle, just that muscle, for example, if you don't do that, then it'll tighten up and they'll have a hard time bending their knee the next day.
So what are some other more acute type injuries that you might see that might be sometimes even alarming?
Well, very commonly in our sprinting, so every sport has some type of sprinting. Basketball, whether you're running up and down the court, football, sprinting for a ball, baseball. It's very common this time of year to see hamstring or adductor or your big leg muscle strains. And so we grade strains from 1 to 3, 1 being just a very minor injury that may take 5 to 7 days to completely recover. Grade 2 may be closer to 4 to 6 weeks, and a grade 3 where you completely rupture a muscle or a tendon can take upwards to 3 months to completely recover, and very rarely may require surgical treatment. But the importance is recognizing those injuries and treating those right away. Seeing your athletic trainer who's very knowledgeable in those and starting the rehab process on a relatively acute basis so that we can get that athlete recovered.
Honestly, I think we've got to really tell everybody how important our athletic trainer is for also the management and helping us with the team or the teams that we take care of. So it's a really great team approach with Dr. Shupe, myself, and our athletic trainers here, and wherever you may be at as well. So it's always good for our parents and the coaches and the student athletes to make sure they have a good rapport and trust in their team members.
And we're fortunate here in Texas that athletic training each high school has an athletic trainer depending on the school district that you're in, but you have great access to health care and really on-scene injury management. Other sort of in-season injuries that are pretty common are dislocations. So whether that's a finger, whether it's an elbow or a shoulder, I'd probably say fingers and shoulders are the most common things that we see. And managing those in timely fashion is important. If you can realign the joint in a relatively quick manner, if it's not too difficult to do, so you just either pull a finger into full extension or have your colleague help with a shoulder dislocation. If you can get that in right away and you're confident and comfortable to do that, we can get that athlete on the way to recovery. If you're ever not comfortable doing one of those, it's not bad or not inappropriate to split those things and get that patient to either an orthopedic surgeon or an urgent care for management of those injuries. And we also like to touch on, it's not necessarily that immediate relocation that you're going to be more concerned about, but it's sort of the duration. When can we get that athlete back into competition for this in-season management? For fingers, if you can pull them straight, tape them together, they can probably get back in relatively quickly. Shoulder dislocation, we like to talk about having full strength, full motion, basically the ability to protect yourself to get back into competition. And that can be as soon as 1 to 2 weeks after an injury if treated appropriately, or it can be several weeks beyond that.
Well, the same thing applies on the medical sides. So anything that you could generally have from a medical condition outside of sports can always occur during a sporting season. So making sure that we recognize that and it's treated accordingly is very important. But before we can clear them to go back to participation, that they are fully assessed. So right from the beginning, if we can get a good history, and especially if maybe we're at a high school game or coverage, if their parents are there, we're able to talk to them. That's always better, because sometimes the athlete themselves may not be completely knowledgeable of their medical history themselves. So generally speaking, the more information we have that we can help to make sure we can get our athletes back into play, be it on medical or both on the musculoskeletal side of any acute injury. So I hope you found this useful, and please recognize anywhere that you're at with any sporting activity to make sure you know who your providers are, able to help you. I think it's really important that you know what's available, and we're certainly here happy to help you. Dr. Shupe, any final thoughts?
So as healthcare providers who cover athletics and sports, our primary focus and our primary goal is the safety and health of your students, your kids, your athletes. And so we've covered kind of a broad topic, haven't gone into much detail here, but the importance that we want to get across to you is that if there's an injury, it's important to recognize it. If your athlete complains of something in general, it's something that you want to pay attention to. Some injuries are very noticeable because they're catastrophic. You see it on the field or in the field of play. Others are more subtle, such as your overuse injuries. And so first, we want to recognize it. And second, don't panic. If you are presented with a situation that seems a little bit hairy, just make sure to keep your wits about you. We are here. We are easily available. Physicians throughout your area, whether it's Andrew or I or with our group, are happy to take care of any injuries that occur either in the field of play or on the weekend or wherever you're at. But the important things really are recognize it, don't panic, and our goal is the health and safety of your student athlete.
Thanks, and have a good night.
And if you want to continue we thank you for tuning in to this Game Ready session tonight. There are multiple sessions coming up each Wednesday this month, and we invite you to continue to tune in. Thank you.